I think Dr. Ambrish would like to say something more in about this brain stroke.
No, I think you've covered everything, and I think brain strokes are common, but we must recognize early signs.
Right.
And you briefly mentioned the initial hours are very crucial. If you pick up that deviation of the angle of mouth, or difficulty in speaking, or suddenly eyes not closing, or one part of the body not moving,
Right.
Or just you can't speak properly, some
Right.
stuttering, stammering, you can't understand what's happening, or why this hand is not following your command, your fingers are not moving the way you want. At the slightest hint, you should be seeing a doctor.
Sure.
Because if you are developing a stroke, then early interventions can completely abort the attack or minimize the damage. Whereas if it goes on, the brain doesn't recover. So if some part gets really knocked out, then you're stuck exactly as the way he said. I mean, I think if you ask me, it's not a good position to be in, to have a major stroke and then you're alive and you're on bed, you're like a vegetable. I mean, that's a very sad story, and we see it every day. So I think young strokes are also common in India. We should be careful about our testing. We should, if required, take an aspirin depending on the kind of stroke, and statin. I'll take one more minute to explain the problem of misinformation,
Yes, please.
using statin as an example.
Yes.
So statins are so much maligned in the media. Statins have changed the way we look at heart disease and stroke. Before statins, your angioplasties, etc., would have been a pretty, doubtful results, plus minus results, short results, immediate relief, but no long-term effects. Statins have added years of quality of life to human beings. I think they're one of the greatest discoveries in the last few decades.
Right.
And yet, they're maligned so much on social media and others that a lot of patients who are clearly candidates for statin, for whom it is potentially life-saving, will stop it. For some obscure reason that my muscles will hurt, they're not hurting, but they may start hurting, or I might become weak. And somebody comes and says, I'll get depression, and all kinds of funny things which you haven't even heard of in science, but they create those things, and they give up these drugs. Please ask your doctor what drugs you should be taking for prevention of heart disease and stroke. Do not follow Instagram and this. You may see what you like, but please don't follow those so-called influencers who are not even doctors.
Correct.
But we like to follow them.
A lot of misinformation is there on social media.
So it is thought that
Very
almost, I've forgotten the exact period, in the UK,
Yeah.
800 deaths could have been prevented if people had not not followed this and not stopped their statin. And over a period of time, it was 2,000 deaths.
My goodness.
So imagine over a period of 3-4 years, maybe 1,000 to 2,000 people in the UK, a small country like UK, lost their lives because they gave up statin. And they gave up statin based on media reports. So I think we need to be a little careful. Some trust. Find a doctor whom you can trust. But then please follow what the doctor says.
Absolutely.
And don't do your own thing.
So coming back to social media, I read somewhere there was a bromide in overdose in one case, which is like case used to be seen in 1920s. And when doctors checked it, they found that person was doing self-treatment, following the advice on social media.
Yeah.
So
Social
got to be very
media
careful. Yeah.
Can, God, and now everything that I eat, I realize I've read some article that it will probably cause cancer. So if I were to follow social media, probably I'll have to only live on love and thin air, because every single edible thing
the air is not
is
thin.
going to cause cancer.
Air is very heavy.
Correct.
Air is not thin. Air is not thin. So China has come out with some guidance.
They have
on
come
this.
up with a policy
Very interesting.
very
that
recently.
Health-related issues cannot be spoken on the social media, by non-qualified professionals. That is a
Excellent.
punishable crime.
Yes.
Well, it will be impossible to implement in a country like India, but China has done that at least.
Yes.
Okay, that was some very interesting take on what to follow and what not to follow on social media, especially when it comes to seeking and probably undertaking unsolicited and unverified medical advice. Moving on to Tarun, my next question is to you, and double-clicking on emotional meltdown, or let's say emotional breakdowns, which I'm sure that men too very often go through. Very often men once again try to treat this as, let's say, a PC or a computer or a laptop shutting down or breaking down. But it's like restart and once again get going. Everything is all right. But that's not what it exactly is. So what's your advice? What should be the coping mechanism under emotional breakdown, especially for men?